mental illness. It warns we're entering a dangerous new phase. The study's lead author and former Australian of the Year, Professor Patrick McGorry, says the crisis is threatening the cohesion of societies around the world.
Here in Australia, we've seen a 50% rise in prevalence of mental ill health in young people since 2007. It was already the peak period of life, with 26% of young people in 2007 experiencing a mental health problem in any given year requiring treatment. And that's jumped to 39% in 2022. So a 50% rise in need for care. So when that sort of thing happens, you have to look very deeply at what's causing it, and it's got to be very serious mega trends in society, mainly socioeconomic changes to the way we live and the way we operate in society, and of course those things might be very difficult to identify clearly and change, and in the meantime we've got a massive problem with the system such as it was. It was a very underfunded and embryonic system developed to meet this challenge. It's got completely overwhelmed over the last 15 years and needs a major redesign and investment and rethink.
You said there about identifying these global trends. Now, in terms of climate change and social media, I think that's been well documented. What about intergenerational equality, though, that is mentioned in the report? We're all aware, obviously, that it exists, but do we fully understand or factor that in when we're thinking the impact on mental health of youth?
No, well, you can see that some politicians have gone for the kind of knee-jerk, it's all social media explanation. Well, it's clearly not. I mean, social media is a symptom, and the fact that it's just an unregulated wild west of a space run by, the tech titans or the techno-feudalists, as they're called. They are just allowed to run wild, these people. So definitely that's one aspect, but that's a symptom of a wider problem. And we've seen, the economic theories that have guided the world over the last few decades, that the chickens are coming home to roost. And that's what we concluded, that there's a fragmentation of society and a huge amount of wealth transfer occurring between, people lower in the food chain and a small number of extremely wealthy people. In The Guardian yesterday, you saw reported that the wealthiest 200 people in Australia have gone from owning 8% of GDP in terms of wealth to something like 24%. So there's a traffic of wealth. It's not trickle-down economics, it's flow-up economics, and that's affecting everybody. But young people are probably the miners' canaries of society, showing up the consequences of that, because they are economically incredibly precarious now compared to previous generations. They can't buy houses, they've got insecure work, they're coming out of their period of education with huge debt. So everything economically adverse that you could think of is being visited on the next generation, weakening their mental health, and then we're not even treating their mental health problems when they occur. So and that's all the negative side. There's a huge opportunity to strengthen society if we address this problem, both in the prevention sense, by tackling these very harmful social and economic policies that are not being addressed, and on the other hand, building a system, which we've been the world leader in doing that, building systems of youth mental health care like Headspace, but they've been completely washed away almost by this wave of new demand. They need to be rebuilt, re-strengthened, and added to with systems for the missing middle, the people with more complex problems. Now, the mental health ministers and health ministers are meeting on Friday in the wake of the Bondi shooting, and they are charged with looking at this missing middle problem, the young people and older adults too, with more complex problems which fall between federal and state funding. And all of these people, when they become more risky or dangerous or more distressed or suicidal, they end up in the emergency department, which is the worst place to be providing mental health care. So it needs to be a top priority in health reform, and it's currently not.
Professor Patrick McGorry, thank you for joining us.
Thank you.
It's been confirmed the pilot killed in a chopper crash